Yeah.
Okay, we're on.
So we're on. Hi, I'm Dr. Karen Austria, and I'm here today at the Digital Health Festival 2002. I'm here with the high esteemed guest speaker this morning, Dr. Nick Coatsworth.
G'day, Karen.
Good day. So, can you tell us more about the Punctured Equilibrium and what it means for digital health moving forward?
Yeah, so punctuated equilibrium basically means that policy and process stays in train for many, many years longer than it should until there's a shock that actually changes it. And in this case, it was COVID-19. Now, it's one of many policy theories, and there's other policy theories that dictate that you can have policy change. But I think for the digital health audience, it's about recognising that you don't need a pandemic to create a punctured equilibrium situation. You can do so through disruption, you can do so through taking opportunities like hospital accreditation, for example, just things that are going to shift the dial in the minds of policymakers and really increase what we call in policy terms the salience of the issue, and that can open the window for you to drive the digital health bus through.
Yeah, and I also love your personal story on your father in aged care. So how do you believe aged care can help improve those patient experiences from a full transformation and digital disruption?
Well, there's probably one main thing, and I think the reality of aged care, we need to try and improve it, but we know that it has a relatively low-skilled workforce as a base. That's a reality. Now, we need to increase that through improved pay and various other things, education. But if you deal with that reality, simplifying the way you give care through digital technology and enhancing people's ability to interact with the patient through straightforward digital platforms is one of the answers. And, I've seen that in action at one of the nursing homes where very straightforward iPad-based digital health records that, tell people when they need to deliver their care, tell people a bit about the client, all that kind of stuff. That can be really, really effective.
Yeah. And lastly, you're also doing a PhD on public policy. So Punctured Equilibrium, public policy, how do they tie in? Well, such an interesting background.
It's one of the theories that I'm looking at as to why we shut the Australian borders. That's the thesis. It's funny, Karen, PhDs don't write themselves. Who knew? But it's taking up a fair bit of time, and I think if you, like any sort of project, if you want to see it through to conclusion, it requires a high degree of focus, and that's a message for anyone here at Digital Health Fest today. If there's something you really want to do, focus on it, and you'll get success in the end.
Yeah, and I also like your thoroughbred horse analogy. So, guys out there, if you want to talk to Nick Coatsworth, we're not looking for a unicorn, but we're looking for that thoroughbred. So think far out, Punctured Equilibrium, and also enabling policy and stakeholders for that will buy in. Thanks, guys.